everyone, and welcome back to Pain Exchange, a monthly podcast from the International Association for the Study of Pain, highlighting global innovations in pain research and amplifying the voices of our diverse membership. Every year, the association focuses on a particular aspect of pain to increase awareness within the community and beyond. For 2026, IASP President Dr. Andrew Rice has decided to focus on a subfield close to his heart, neuropathic pain. Neuropathic pain, typically resulting from injury, disease, or dysfunction of the nervous system, significantly affects quality of life in those experiencing it. And despite this and a wide availability of effective drug treatment options, many cases of neuropathic pain remain under or completely untreated. The goal of the global year will be to raise awareness of issues like these and more surrounding the topic. To lead this awareness campaign, President Rice has recruited Drs. Neil O'Connell from Brunel University of London and Angelika Lampert from RWTH Aachen University in Germany. And today I have the pleasure of speaking with all three of these prolific scientists about this important topic. Hello, everyone.
Hello. Hi there.
Hello.
First, I know I already gave a brief explanation, but what exactly is neuropathic pain?
Yeah, so that's not easy to define, but I think you made a great introduction already. So, neuropathic pain affects the peripheral nervous system, but it can also happen in the central nervous system, and it is a damage to the nerves. And it is something that is experienced by the patients as burning, pain. It can also have different other qualities, but it's sometimes experienced as really devastating. It impairs the daily life of the patients. And unfortunately, quite often, you cannot really see a cause from outside. And thus, it is sometimes for the patients not so easy to communicate what's the problem. And this may also be one of the good reasons for this global year, that we can actually start also communicating better on what it is and how it is perceived by the patients, and what are our current understandings of the mechanisms and strategies to treat it.
And kind of along that vein, Andrew, I understand that IASP presidents decide on the global year themes during their presidency, and that theme was neuropathic pain in 2014. So why did you choose to highlight neuropathic pain again just about 10 years later?
Thank you, Renee. Well, one of the reasons is that neuropathic pain is common. About 7 to 10% of the population afflicted by it. And some of the drivers of neuropathic pain are increasingly globally more and more important disease areas, particularly diabetes and diabetic neuropathy. Often global years have one or two broad areas. Sometimes they focus on a disease underlying some aspect of pain, cancer pain, arthritis, or low back pain, for example. And others, they focus on a particular population. So the 2025 global year focused on lower middle income settings. And so I wanted to revert to a disease-based global year theme. And you're very astute. We did have a global year on neuropathic pain in 2014, so we're only just over 10 years later. But a lot has changed. And one of the main drivers was that the Neuropathic Pain Special Interest Group of IASP conducted a major meta-analysis of clinical trials. And the number of clinical trials in that 10-year period had approximately doubled from around 180 clinical trials to around 300, or just over 300 actually, mainly in the area of pharmacology, but also in the area of neuromodulation. But in one way, surprisingly, actually, the recommendations haven't changed that much despite that increase in knowledge. And what it has raised to us is that there are important areas relating to how we view neuropathic pain that we need to focus on. And this global year is going to have those as sub-themes. One of which is how we compile and use evidence to inform clinical practice. But the second one is that clinical trials only let us know what is happening at a group level in a rather artificial situation. And whilst the efficacy of most of the pharmacological interventions, for example, for neuropathic pain, are not that great, in fact, they're pretty poor, we also suspect that some patients respond to some treatments. And therefore, we want to introduce this concept of precision medicine. And one of the reasons we've involved not just the neuropathic pain SIG, But MESIG, the SIG that concentrates on evidence and research methods, is to try and understand in this global year what type of research we need to do, both in the clinic and pre-clinically, to better advance this agenda of precision medicine.
Nice. And so I'll transition over to Neil and Angelika. How do you guys fit into this equation? What are your backgrounds in neuropathic pain?
So my title at Brunel is Professor of Evidence-Based Healthcare, but most of my research is around evaluating the effectiveness and safety of interventions for pain, not with a specific focus on neuropathic pain, although we do touch on interventions for neuropathic pain. But until recently, I was the coordinating editor of the Cochrane Pain Palliative and Supportive Care Group. And that was the Cochrane group that curated and published the vast majority of Cochrane reviews that spoke to the evidence for interventions for neuropathic pain. Going all the way back, I'm a clinician. I'm a physiotherapist by background. And so I've got quite a lot of experience in a generalist musculoskeletal setting of encountering people with suspected neuropathic pain and having to navigate what is actually quite a difficult clinical picture of confirming it and finding interventions that might be helpful. And lastly, the reason I'm here is I'm the current chair of the Methods, Evidence Synthesis and Implementation SIG. And as Andrew said earlier, our focus is really on driving robust methodology across the piece in pain research. And we want to bring some of that focus to the global year.
Yeah, thank you. And my background is maybe a little bit more on the neuropathic pain. So I am also part of NUPSIG, the Neuropathic Pain Special Interest Group. And as a trained MD, I'm very much interested in translational research on the mechanisms that underlie neuropathic pain. And I'm a professor for neurophysiology, and we study the mechanisms of it using stem cells and other in vitro models in the lab in order to really nail it down to molecular mechanisms that then potentially would open up new treatment fields that would directly relate to what the patients are suffering from in clinics. So I think it's a really nice combination to have the more methodological approach of MESIG combined with NUPSIG. Because in a way, I think we both can profit a lot, and I think it's a good step forward in order to finally find out why we didn't progress more. Because in a way, I focused on neuropathic pain because it's confined to the periphery, more or less. I mean, no, it's not, but there are certain aspects which are really peripheral in the mechanism, and I try to focus on that, and I am always a little bit surprised that even in those peripheral mechanisms, we can't really understand it yet, and we don't really have treatment that successfully, reliably treats all of our patients suffering from that intense pain. And I think this is why I focused on neuropathic pain, and that's why this is my background.
Nice. And so it makes a lot of sense that, Andrew, you were saying it was going to be kind of a collaboration between the methodology SIG and the neuropathic pain SIG. And so it looks like you have two great representatives of the methodology SIG in Neil and the neuropathic pain SIG in Angelika.
Absolutely. And that was, for me, a way of bringing together two of my greatest passions. One is rigor in research, and the other is neuropathic pain. And also, I'm very keen to enhance and encourage collaboration between SIGs, because SIGs are there for special interest, but there's often overlap in those. And I'm just going to embarrass the other two speakers just for a moment, because not only are they leading the effort for this global year, they're both individually doing absolutely fantastic work in their own laboratories and groups, and completely independent of the global year. They've both been selected to give plenary lectures at the World Congress in Bangkok. So if you want to find out even more about the exciting work they're doing, come to Bangkok and listen to more detail about what they're doing individually as opposed to the task force for the global year is doing more generally.
Wow, congratulations, Neil. Congratulations, Angelika.
Thank you.
So what do you guys have planned for this campaign so far?
So we've put together a fantastic task force. So a truly international, interdisciplinary task force that covers preclinical and clinical research, various disciplines of clinical practice. We've got lived experience of neuropathic pain in our members on the task force, and also experts in communication skills. So we really are well set up. The other thing that we've been careful to do is to try and get representation across the career spectrum. And we're really happy that we've done that as well. And so the kind of key outputs from a global year, and Angelika, do chip in or correct me if I get anything wrong here, is, our job here is to raise awareness, to share information, and to try and drive the agenda forward. And so we've got planned a series of fact sheets that are largely public facing, trying to explain what neuropathic pain is, how we diagnose it, best approaches to management, and then also touching on some of these sub-themes like precision medicine. And we've also got a couple of fact sheets that aren't focused on the public, that are focused on researchers and clinicians as well. So they're in development at the moment. And then across the year, we've got a set of webinars where we put teams in the task force together to try and develop webinars. And we'll launch in January with a webinar that really outlines what neuropathic pain is in a bit more detail, the burden of it, and to set the sort of stall out for the global year. But we'll have webinars that focus on diagnosis, on treatment, on what it is to live and live well with neuropathic pain, on precision medicine as well, and on mechanisms of neuropathic pain. So we're hoping that through those webinars, we can really give a good account of where the state of the art is, both in how we understand the condition and the mechanisms that underpin it, and where that story is going into the future, and then how we best identify and manage it in the clinic, as well as really reflecting the challenges that neuropathic pain places on people and places on societies as well. Just to touch on that precision medicine thing, that's a key sub-theme, as Andrew said earlier. Precision medicine it's like a holy grail, and it's not just a holy grail in pain. It's a holy grail across pretty much every condition that doesn't resolve on its own. And that is, how can we really identify which treatment works for whom under which circumstance? And it's very appealing. It's also a kind of concept that's wrapped up in hype. It can be oversold as well. And the methods that get us towards precision medicine are often quite challenging. And so the approach that we're going to take in terms of considering precision medicine is to take a really critical view of what that is and what that challenge is in order to get us there, and really to engage with the different methodologies at different parts of the research pipeline and what they can and can't tell us about precision medicine under the kind of broad umbrella precision medicine, what it is, what it isn't, but what it could be. What did I miss, Angelika?
Not much. This was really a really nice overview of what we are planning to do, and I think it provides nice resources that can be found then on the website, but also will be distributed. I think with the webinars, we are creating discussions among people that may not normally meet in this way. And like this, we can somehow generate, hopefully, new interactions and bring in new aspects. And especially this merge between MESISIC and NUPSIC may also help us to reflect on the way how we perform research and also how we are treating patients in the clinics and trying to generate new knowledge about how we can improve that. And I think one aspect that you both mentioned already several times is also that we have the patient partners who will help us to improve on both sides. And they are actually also bringing in completely new ideas, which go all the way to having some art projects and bringing in new ways of expression by which we could maybe even improve the communication between the different stakeholders, which are really important.
Yeah, wow. That's literally every single part of IASP all coming together on this topic. It's wonderful.
Can I emphasize there are two particularly important aspects that, IASP's thinking has been evolving very much over the last few years. And that's why I'm really thrilled to see excellent representation from people who are early in their careers, particularly as we're formulating ideas that will shape research agendas going forward. But the lived experience, and as Angelika has just said, They're bringing all sorts of novel and interesting ideas. And we didn't involve people with lived experience a few years ago in these things. It's unthinkable now. But I just want to congratulate you for bringing forward such a wonderful task force.
Thanks, Andrew. The other thing that I didn't mention, and perhaps should, is that we're going to be using the Global Year to draw attention to neuropathic pain research through various channels. So we're going to be screening papers that are due to be published in the IASP journals, Pain and Pain Reports, and we'll be badging those with the Global Year to really try and raise awareness of those. We'll be doing similar activities around the World Congress in Bangkok next year as well, so that we can really try and bring together all of the fabulous work that's being done in neuropathic pain and sort of use the Global Year as a kind of way of kind of really highlighting it and pushing it out there.
And there's another aspect of that is important. I think it's important to emphasize that Global Years have two facets. One of which we call the outward-facing asset, which is about advocacy, raising awareness in the general public, particularly equipping our members and chapters with important information they can use to advocate. And our chapters and federations are often very powerful supporters of the Global Year. The Australian Pain Society is always one of the strongest supporters and take it as the theme, as do other chapters. And then there's the inward-looking components where we can focus on the particular debates and emerging themes within our society professionally. So there's outward and inward-looking themes, and they're equally important.
That is both really important. So it's not just you're showing that you're advocating for this, but also doing the work to research it and push the knowledge base forward. So that's really cool. And so kind of we've been talking about Bangkok and the 2026 Congress kind of tangentially, but what plans do you guys have to highlight this campaign while we're there?
Yeah, I think one of the measures that we will have there is already mentioned, and that was the badging, because I think there is a lot of research already going on in neuropathic pain, and using the badge of the Global Year will help to highlight that, and it will show what is going on and what are the new developments there. We also submitted a topical workshop where we actually have speakers from both sides representing the methodological approach about how to perform, in this case, basic science research. And then we have a scientist speaking on that as well. And the idea is that we would showcase in that workshop how we can synergize by reflecting on the way we perform research and on the methods that we have. In order to improve and finally get closer to identification of new treatment. And one thing that I'm pretty excited about, and it's still in the making, so I can't really say too much about it, this is the idea that was brought in by our patient partners, where they have the idea that maybe we can somehow find a way to match art and neuropathic pain and expression of it and communication. And we're still in working it out. I mean, it's still less than a year, but still a couple of months to go. And then the idea would be to see whether we could somehow gain new aspects and new understanding of what neuropathic pain means. And that could also then help us, scientists and other clinicians, to find a better way to actually assess neuropathic pain, its treatment, its understanding, and then hopefully identification of new mechanisms and treatments.
Exactly. So I think that intersection of art and science is really interesting because they always say a picture paints 1,000 words. And when you're talking about precision medicine, that can mean so much to talk about one person's experience and possibly how to treat their pain. So that's really cool.
I do agree.
Just going back to the question before about things that we plan. Of course, the thing that I didn't mention is we also plan to create 2 state-of-the-art review papers. And I won't share the topics just yet because I think that'll be something that we'll release in January. But there'll be 2 state-of-the-art review papers to be published in one of the pain journals that really speak to some of the key content that we cover in the Global Year. So look out for those.
And a couple of other points. So in Bangkok, we'll also be releasing the outputs of the current presidential task force, which is updating our guidelines on the use of experimental animals. And experimental animal research is very important. Area in neuropathic pains where a lot of our basic science knowledge comes from, but we don't know quite how to translate it. efficiently yet. So that's another aspect of the Bangkok Congress. The other point I'd like to make is that although the global year finishes on the 31st of December 2026, that's often only the start of something. What we really hope to do is encourage conversations and ideas, particularly have the basic scientists and the patients and the clinical scientists all talking to each other to generate conversations that will go on and improve and create collaborations for many years ahead. So really, global years are only the start of things often.
Yeah. So kind of building off of that, what do you hope that people will get out of this campaign, both IASP members and maybe not IASP members?
Well, I suppose there's a list, isn't there? I mean, but personally, I think if we can, first of all, increase public understanding of what neuropathic pain is, why it matters, what it means to people who have it, I think that would be a fabulous achievement. And, we hear very clearly from our partners on the task force who have lived experience that while within IASP as a community, we might all think that we know what neuropathic pain is, outside of our bubble, actually public awareness is very low. And it's really important that changes. And I'm sure it's a source of constant frustration to people who live with neuropathic pain. I think we want to support best practice in terms of how we identify neuropathic pain in the clinic and then how we best manage it with the tools that we currently have available. I think we want to share the best knowledge of what it is and why it's there and looking for new targets for management as well. And I suppose we want to bring the IASP community together to discuss this stuff and to think of better ways forward, as Andrew was saying, to promote collaboration. And so what I would personally really love to see, particularly when we have our webinars and then we have our session in Bangkok for those who can make it, is really strong engagement with the webinars and the discussion around the webinars, because that's where the conversation will be happening largely in the global year. And the more of the community that we can get together, the more chance we have of really driving that conversation forward.
So I think you covered this really, really nicely. It's actually the interaction between the groups, which I would be super happy to see if this could be enhanced. Because I think if we manage to do this, that the clinicians, the patient partners, the basic scientists, that they would all interact more, I do think that then we have really a good basis that this global year reaches longer than just 2026.
And just to add, I mean, it'll be great as well if we manage to achieve our goal, which is that we discuss and present this information based on the best evidence, fully acknowledging uncertainty where uncertainty is there, stripping away hype, but not possibility and promise, and really taking a careful evidence-based approach to all the information we share. Then again, I think if we can say that we did that, then we've succeeded.
I think so. That sounds like exactly what the importance of science is right now. And so I want to thank all of you for being here and for talking about the global year, but is there any last kind of thoughts, trains of thought you want to add about neuropathic pain, global year?
No, I'm just really excited. I do look forward to this. I must say that I'm a little bit overwhelmed by the enthusiasm that I found within the task force. That is really exciting. So I think there's a lot to look forward to in 2026 that comes out of here.
I agree. And I think, while the global year starts in January, the work started quite a few months ago now. And in the task force at the moment, there's a hive of activity going on. And so just to say thank you to everyone who volunteered to be on the task force and for what you're going to contribute to the global year, because we couldn't do it without the team.
Absolutely, yeah.
Oh, and the team at IASP as well, who offer fantastic support to make this happen.
I think without the people who are engaging here and the structures which are there, it would not be possible. So let's look forward. Thank you.
And just to say really very sincere thanks to everybody who's volunteered to be part of this and the staff, because it's really important. And we were overwhelmed by the response rate we got to advertising this and the talent that Angelika and Neil have been able to attack. So I'm very excited and optimistic.
Perfect. Amazing. Thank you guys so much. Thank you, Andrew, Neil, and Angelika for being here and for talking with me about the global year. And Make sure to keep an eye out for all of the activities going on about the 2026 global year on neuropathic pain from IASP.